So then, sir, first thing we're going to do is a little bit of skin prep, just to make your skin nice and clean.
Is that all right?
No, it's perfect.
Not enough?
No. Right. We have a Romanian nurse with us today, Terry, so we're going to conduct the procedure mostly in Romanian today. Okay. We're going to try. Ana, ce este cuvântul pentru antiseptic? Antiseptic este românește?
What?
Ce semănă? La fel?
Antibacterian.
Da.
Antibacterian. That's the word.
Foarte bine.
Actually, mine.
So, Terry, first off, there's going to be two little scratches going into the toe, okay?
Yeah. Try not to make me jump.
Okay, I shall try.
Look, obviously you're going to feel a pinch and pressure and everything, okay?
Yeah.
Because it needs to go inside the anaesthetic. So it's a lot of pressure going in.
That's stinging.
Don't, yeah.
Oh, that is stinging.
One down, one to go. 3, 2, 1. So, Terry, how's that feel? Any pain at all? Any discomfort?
A little bit when you press.
A little bit of pressing down. So the anaesthetic I've used is a long-acting anaesthetic, so you'll be numb for ages, but it's a little slower to work.
Yeah.
Okay. Just massaging it brings it into contact with some of the tissues.
Right.
Oh, we do this afterwards.
Yeah.
Not now.
So let's just have a little test, Terry. So again, the question is.
Look away.
No, I have to watch Anna. Any sharpness, Terry, around the base of the toe?
No.
Tip of the toe?
Yes.
Little bit there.
Yeah.
Okay. But do you feel the difference between the other one?
Yes.
It's on the way. It is on the way.
What else you might need in there now?
Mm-hmm.
I mean.
So a little bit of saline, please, Anna. Saline or Savlon, just for irrigation.
So what actually caused the toenail to go like that?
So it's typically damaged, Terry. So what happens is over time, years of stubbing. Now your toe is slightly sticky uppity, okay, so years of being sticky uppity, it's always bashing on the underside of the shoe.
Yeah.
And then it causes the nail to get causes the nail root to become damaged and traumatised, really.
In my youth, I used to play a lot of football.
Well, that'll do it as
well. I
well.
lost toenails a couple of times. There was a lovely shiny one coming underneath when they came off. But,
Yeah. Who do you follow?
Well, Northampton, obviously.
Well, I suppose you would do, wouldn't you?
Well, I come from Northampton.
Well, there is that.
Yeah.
How are they doing this year?
A third at the moment.
Really?
In the second division, yeah.
Ooh. Friend of mine, he's a Man U supporter.
Oh, yeah.
I was around his house last
It
night.
was horrible yesterday night.
And was it last night they got beaten by Liverpool?
Yeah.
And he was really upset. I was around his house, and when the score came up, his dog started crying. And I said, "What's the problem with your dog?" He said, "Well, his dog's a Man U supporter as well.
Yeah.
And every time Man U get beat, the dog starts crying."
Oh, dear.
I said, "Well, what happens when they win?" He said, "Oh, I don't know. He's only 2 years old."
Yeah.
Right, how are we doing?
Can't really feel that.
Can't really feel it. So no sharpiness there.
No.
So that's taken a few minutes to go off, but that's very typical for that particular anaesthetic.
Yeah.
So we do under a little tourniquet, Terry, so there ain't no bleeding, because particularly with you being on aspirin, you might be. It's one of the questions I get asked by podiatrists about once a month. What do we do with a patient who wants nail surgery who's on a blood thinner? So it'd be an antiplatelet like aspirin or an antithrombotic.
Yeah.
And we say, crack on, you're fine. Because there used to be a rule of thought to say, take you off aspirin for the time of surgery.
Yeah.
But we now realise actually there's a bigger chance of having a stroke or something of that ilk.
I've had problems with bleeding. I suffer from nosebleeds.
Yeah.
And about every 3 years or so, I have to have it cauterised.
Really?
Yeah. 11 years ago, I had a heart attack. Had to have a stent fitted.
Okay.
And so that's when I started on the aspirin. But they also put me on clopidogrel, which stops it from clotting.
Yeah.
And I was having nosebleeds at the time, and I was waiting to have it cauterised, but I had the heart attack before I had it cauterised.
For real?
And I started getting nosebleeds again, I could not stop them. I thought I was going to bleed to death.
Yeah, it's quite vascular, isn't it?
Yeah, I had to go to Northampton General one time, A&E, and they couldn't stop it either. They had to put a nose tampon up your nose.
Yeah.
It goes all the way up till it's right at the top.
No, it's not very pleasant, is it, Terry?
Oh, that was so painful. My wife was with me, and I was really yelping. My wife said, "Stop being a baby."
No,
and
it's really
the doctor was doing it, and the nurse said to her, "You don't know how painful that is." She said, "I've had people hit me before now. That's why I don't do it anymore." And
Anna, are we still in shot on the old video? Just because sometimes the foot will move around. We still got a nice angle.
Yeah.
Yeah, it's okay.
Yeah.
So that's a really thick toenail, Terry.
yeah,
And
I've left it too late.
Well, we don't live in a blame culture.
No.
Let's see if we can get this fella off.
You okay?
Yeah, I'm okay.
Yeah.
Me? Well, I've got an old shoulder injury. This is hurting. This is. Okay, so there she is, and just the amount of thickness and gnarliness. So if we send that away, we probably find some fungal elements in it, but it's primarily a thick toenail. Oh, sorry, thick toenail.
Yes.
So we'll get these bits of skin out because they're neither use nor ornament. So that's nice and clean there.
You okay?
Yeah, I'm fine.
Yeah.
I'm feeling hot, but I think it's hot in here anyway.
You're feeling hot?
You're allowed, Terry.
Yeah.
Just remove your mask for a minute, if that makes you, feel a bit better, yeah?
No, I'm okay.
Yeah,
I'm not going to pass out.
No, but, obviously.
Yeah.
So, well, then we'll put some phenol on. So, Anna, what time is it now, Chucky?
It's, oh,
4:05.
no,
It's,
that's not good.
It's 25 to 7.
25 to 7.
Okay, so I want 4 minutes of this.
Right.
We used to use 3, but we're finding that it's a little bit better if we leave it on longer.
Okay.
So if you give me 2 minutes and then we change, and then 2 minutes and then we change. Because I have 1, 2. So we'll do 2 minutes with swab number 1 and then another one.
I thought nurses carried watches.
Well, yeah, but the battery ran out.
Oh, right.
I took it out and I couldn't change it.
Oh, right.
And I'm sure my husband put it in a cupboard and I can't see it now. I looked for it in the morning and I was just like, okay. He has a tendency to put everything away.
Oh, right.
Tidy. Terrible.
Okay, so 2 minutes for that first swab, then 2 minutes on the other. What we'll probably do when I'm editing the video is I'll probably edit some of that out because it's not very interesting to watch.
You do these videos very often, then?
About every 2 weeks, Terry.
Yeah.
I have about 150 videos on YouTube.
Is that because they're all sort of slightly different?
Absolutely. Although sometimes, well, everybody's slightly different.
Yeah.
What I'll often do is try and do 2 or 3 of similar with some different ideas. And it's just when I get something slightly different. So I have a lot on nail surgery, but this is a particularly interesting nail because it's really kind of thick and gnarly, really. So it's just kind of nice to see. 2 minutes. Thanks for that.
Oh, no, I did look on the internet myself at nails, and there were some there that were a lot worse than mine.
Mm.
Well, we had a patient do that. He went into B&Q and got no more nails. I said, no, that's not the stuff. Doesn't do it for toenails.
Yeah.
So we really wanted to blanch that nail bed and really give it a good hit with the phenol. So because of that, Terry, we'll get a bit of a burn on this bed, and that'll take about 4 to 6 weeks to heal in.
Yeah.
And if anything, we want a bit more of a burn so that reduces the risk of it growing back.
So is it going to be fairly painful then? Once it...
Not too bad. Yeah, not too bad at all.
Depends who you're asking, unfortunately.
Yeah. No, most people don't do too badly with this.
Well, I've seen people coming to me and saying...
Not my patients, Anna.
No.
Maybe one of the other surgeons here, whose name shall remain nameless. Or it could be her. But no, it's not so bad. But occasionally it can be a little bit sore. Do you have my mobile number, Terry?
Oh, I don't think so.
No, and that's why. How are we doing for time, Anna?
Yeah. 20 more seconds.
So I really work it into the bed, and that looks like it's done a nice job at blanching. But that'll do it. Okay.
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 Yes,
done.
Okay.
Thank you.
So, and then we'll just irrigate. Oh, you've got some nice big gauzes there. Great. Look at those. Okay. Pop that there. Just do a little bit of, just dry it out. And we have our non-stick. Now some people, I don't know why they call this non-stick, Anna, because when you put it on it sticks to everything. I mean, look, it's lovely,
Yes.
but it's not exactly non-stick. But there you go. Right, okay. So we're now going to put on a chunky dressing. Now, do you have a gauze creepy bandage?
Oh.
That's it. No, that's what I want.
Yeah.
And
No,
then the
you've
most
got-
difficult part of the procedure is getting the tourniquet off. Okay. And then we'll just have a little check, make sure that he vascularises. Yep, nice and pink. Awesomeness. Terry, questions, sir? Anything we've not been through? Obviously, we've had a chat last week and we've had a chat before we did the paperwork, but anything we've not been through, sir?
Yeah, how long do I need to keep this dressing on?
Great question. So 2 days. So I do 2 days and 2 weeks. So I get you back in with the nurses in 2 days for a change of dressing, and then I'll see you in 2 weeks for a little checkup. And it'll be about 4 to 6 weeks to kind of fully heal, and then we'll have a little see how you go for next year.
So sorry, I've got to come back in 2 days.
2 days, yeah,
Okay.
and then again 2 weeks. 2 days nurses, 2 weeks me is my rule of thumb.
Okay.
Couple of painkillers. We're going to keep you there for 2 minutes, just check we don't get any bleeding, any strike through because you've been on the aspirin, so that's not impossible.
Yeah.
Right, Anna, we've got some sticky stuff.
Yeah. I've got
Awesome.
really sticky stuff ready.
Yeah,
Oh, I must have still got to chew on.
yeah, about that.
I haven't got any sandals or anything.
Have you not?
No, so,
Well, if they're good enough for Jesus, good enough for us.
yeah.
Although I suspect if he'd been born in modern times, he'd have been wearing Crocs.
Not me.
No, Jesus would.
Yeah.
Right, sir. Thank you for the video. I shall edit all the swearing out.
Yeah.
Just stay there, stay there.
Okay.
Here's a close-up. You can see the nails quite deformed, slightly involuted, certainly very thick, probably on the border between a bad onychoccyx and a true onychogryphosis. But I'm being a bit semantic there. Quite potentially some fungal elements thrown in there as well, but certainly painful, thick, difficult to cut, and better out than in. So 4 to 6 weeks really to heal with these. I think if I've given the nail surgery quite a good hit with the phenol, and I'm planning to see him back. 2 days the nurses will do a change of dressing, 2 weeks will be a review with me, and I'm planning to do a little follow-up video when he's all healed just to show you the outcome.